North Carolina is the largest city in North Carolina and the banking capital of the Southeast, with a current population of approximately 730,000 individuals. An electronic health record system is imperative in creating a readily available access to timely, complete, accurate, legible, and relevant information, which is critical to healthcare organizations, providers, and the patients they serve. Healthcare data and its transformation into meaningful information should be the essential concern for consumers, healthcare providers, the healthcare industry, and the government. Throughout this presentation, it will become clear that the choice to quickly integrate our electronic health records will allow for the CEO and Board of Directors to perform rational decision-making using analysis and facts. An electronic record of health-related information on an individual that conforms to nationally recognized interoperability standards and that can be created, managed, and consulted by authorized clinicians and served across more than one healthcare organization. This differs from electronic medical record as it only applies to personal health data for a single organization, which is not useful for our patients, and on large, the top list such as Charlotte, with a likelihood that a patient may receive for healthcare services outside of Walters Memorial Hospital. The benefits of the implementation of an EHR system include cost, reimbursement, outcomes, and patient satisfaction. The reduction of costs is primarily due to streamlining processes through automation, such as sending prescriptions electronically, eliminates costs associated with pulling or storing paper charts, the reduction of duplicate labs or tests that have been denied by insurance if performed too soon from the previous lab or test build. Another concern is the cost of the implementation of the EHR system, which includes purchasing of the system, training, and education, rollout, and IT follow-up assistance. The Stage 1 final rules set the foundation for the Medicare and Medicaid EHR incentive programs by establishing requirements for the electronic capture of clinical data, including providing patients with electronic copies of health information. The Stage 2 final rule expanded upon Stage 1 criteria with a focus on ensuring that the meaningful use of EHR supported the aims and priorities of the National Quality Strategy. Stage 2 criteria encouraged the use of health information technology for continuous quality improvement at the point of care and the exchange of information in the most structured format possible. Finally, the ability to file claims electronically reduces ER days, and if the insurance requests medical records, they can be transferred electronically, with some payers also positively affecting ER days. Reimbursement is also positively impacted from the angle of improved coding and documentation, reduction in charge late days, lost charges, and denials associated with late filings and medical necessities. Flags can also be set up if required information is not present on the account prior to filing to reduce the likelihood of avoidable flags. Outcomes are improved through the implementation of EHR in the form of reduced errors, through improved access which will reduce readmission and increase patients' health and well-being. Outcomes are also increased through the ability to directly report to public health systems and registries concerning communicable diseases and disease management. Data systems are created by the ongoing systematic collections of health, demographic, and other public health can communicate with the organization to alert practitioners of health alerts. Implementation of an EHR system will enable to avoid costly federal and state penalties, such as meaningful use through the Centers of Medicaid and Medicare Services that will penalize for both plans. Public policy is also effective because the use of an EHR assists the organization in abiding to the HITECH Act and HIPAA. With a large number of patient encounters, with growing patient contact, the lack of the adoption of EHR can harm the organization. Without an EHR in place, creates 1.5 manual transactions, and even with a small margin of error such as 0.3%, creates the possibility of 4,500 patient encounters with errors that may impact reimbursement, profit margins, or the patient's health. With the current patient volume at 1.5 million, with projected volume increase at a marginal 5% per year, compounding and assuming the cost per bed per day will also grow at a rate of 5% per year, we will estimate that once the EHR system is implemented, estimated upfront cost of $250 million is, and it's fully functional, it will save the organization average of 25% per year to reduce labor costs, increase productivity, decrease errors, and removal of federal penalties. Through multiplying the incremental cost by the output, increasing by 25% expected savings, we can say that an average increase in the general operating budget of 5% per year times the 25% savings, the total operating budget is less than revenues generate, creating a surplus to be used in other areas to address patient concerns. Reviewing and comparing the economic challenges along with incentives is evidence like pros and cons, ways that can assist in the decision-making process. Challenges faced in the implementation include the loss of productivity due to disruption of the in-store software updates. Loss of productivity may also be seen in employees that are either uncomfortable with the change or against the process for various reasons. Prior to rollout, it is important to ramp up employees with demonstrations of how the system will make their job easier and create a culture of engagement and unity regarding the pending changes. EHR adoption and implementation, plus the ongoing cost of maintenance and support, can be a very hard concept to understand without the stakeholders' understanding of the cost as it relates to the ultimate value and benefits. Changes to workflow can also be economically challenging due to lost revenue and reduced productivity, but this should only occur for the first 6 months or so until all staff should be at full capacity. Incentives associated with the implementation will be seen financially through increased financial and operational performance. There will also be increased patient satisfaction due to ease of access to their personal health information. EHRs help practitioners in adhering to evidence-based guidelines and effective care through creating alerts in the system to bring attention to missing information required and possible interactions of medications. Finally, there are financial incentives for both Medicare and Medicaid in the form of increased percentage of reimbursement based on EHR implementation and meaningful use.